In this given case of facial palsy, what suggests that it is a peripheral lesion? So LMN versus UMN type of a facial palsy, how can we basically differentiate? Sparing of the upper half of the face is the feature of UMN, right? Whereas LMN will involve the entire half, and inability to close the eyelid is a very important clue. That's the reason that can lead to development of a corneal xerosis and corneal ulcers. So that's the reason the Bell's palsy patient, we need to be altogether careful to see that the cornea is well protected with the artificial tears, as all of you know very well. Now doctor, a 52-year-old complains of fatigue, numbness and tingling and loss of balance. The blood gas analysis, blood analysis show vitamin B12 is 30%, blood pH is 7.4. What additional finding will you expect in this given case? So, if the vitamin B12 is not there, it is very important for the conversion of the methyltetrahydrofolate to methyldihydrofolate, and that is the reason it leads to a secondary folate deficiency, is what you need to fundamentally remember. Now, I will first go through all the image based and few case study based questions and then roll back. So, what is an important immune defense mechanism? Prasanna, Anu, Surya Prabha and everyone across the country attending the session and our Secunderabad students, almost touching 200 students in Secunderabad taking the exam. As the time passes, more and more, almost you will get a representative sample to call your rank as a statistically significant rank to compare. But don't worry on the ranks. Absolute score 150 you touched in Dr. Bharadwaj class. Mock test, till now in the history, last 15 years, we never disappointed. Those who crossed 150 are within 100 ranks. So that is for sure. But how you can try your best to cross 150 in our mock test, you need to basically take a call on that. If not today, this is the second test in the series of 25 tests. So every test a little improvement. So Candida leads to delayed type of hypersensitivity reaction. Candida albicans is what need to be remembered. HIV positivity is there to the mother and the baby is born, and the organism is grown on the agar. So what is this organism that you are basically seeing? Fundamentally they are called blastoconidia, that is the budding yeast are called as blastoconidia of the Candida albicans. In this HIV positive patient, oral candidiasis is very common, is what need to be remembered. Now, from the stool sample, the organism which has fermented sucrose and comma shaped organism is fundamentally Vibrio cholera, is what need to be remembered. Then for the chloramphenicol, dose dependent inhibition of the bone marrow, why does it occur? So fundamentally it is a 50S ribosomal subunit inhibitor, as all of you know. So which are 30S, which are 50S, and all 8 antibiotics and their mechanism of action. One question definitely will come in the MD entrance, AP PG, Tamil Nadu PG, Kerala PG, every state PG entrance. So be very sure. So every Monday, Tuesday, Thursday, Friday, 4 days we have morning 9 to 7 AP PG, Tamil Nadu PG. Last 20 years question bank, topic wise classified and discussed. So you are all welcome for that, and that actually helps you to sharpen the chisel of your preparation and consolidate it to a limited set of topics and go to exam confidently. Now doctor, inhibition of which substance is done by aspirin? It is the thromboxane A2 inhibitor is what need to be remembered. Now there is a history of trauma to the right side of the head. It is being evaluated and there is a mild hearing loss. The patient says I cannot sweat and the pupil is showing constriction on one side along with anhidrosis is equal to Horner syndrome along with enophthalmos is what need to be basically remembered. Then a 28-year-old woman has got fever and pain in the right upper arm and the radiograph has been taken. And there was a peripheral smear also was done. So what do you see in the peripheral smear? Sickle cells. So that is the reason this osteomyelitis which you are seeing is because of Salmonella paratyphi is what you have to basically remember. Then a 74-year-old with a history of COPD presents to you because he had taken an antibiotic along with some of the medications that he was taking. That is another question. COPD patient presents with jugular venous distension and signs of right heart failure. And ECG, what is it showing? Lead 1 is pointing down, lead 3 is pointing up, QRS complex. They both are right towards each other. So that is right axis deviation. What is left axis? Lead 1 points up, QRS. Lead 3, QRS is pointing down. They left each other. So that is how you recognize left axis deviation. So what you have here is QRS is pointing down effectively. QRS is pointing up in lead 3. So they are right towards each other, right axis deviation, which is also supported by a prominent R wave in the lead V1 along with inverted T wave, which is called as right heart, right ventricular strain pattern. Normally you expect a prominent R wave where in the V6, V1, V2, V3, V6, but V1 which is a right sided lead, if the QRS is, R wave is prominent, that is also an indication of right ventricular hypertrophy. So that is the reason there is a CHF, right heart failure with a right ventricular hypertrophy on ECG, and COPD in the background qualifies it as cor pulmonale is the diagnosis. Now doctor, what is an absolute contraindication of sumatriptan? Migraine drugs, Parkinsonism drugs, 200% you should be sure when you go for the exam. Definitely one question will come. That is what the history of APPG, TNPG, Kerala PG is telling. Right? So be very sure. Coronary artery disease, you should not give sumatriptan. There is a list of drugs in pharmacology which we discussed in the recent DNB. We discussed last 15 years of DNB question bank, 150 hours discussion online. In that we discussed about the migraine drugs, etc. etc. Favorite topic. Bhimaya is a 47-year-old from Mehboob Nagar who regularly consumes toddy, alcohol, and he is found to have methanol intoxication, and you have treated him with intravenous ethanol. What is the basis of giving that? Fundamentally, methanol, whenever it get reduced by the alcohol dehydrogenase, it will convert into formaldehyde, which is responsible for the optic neuritis and toxicity of it. So you will give ethanol which will have higher affinity to the alcohol dehydrogenase and prevents methanol from getting reduced. So that is the whole idea behind giving the ethanol as an antidote of methanol is what need to be remembered. 42-year-old has got chest pain. His complete blood picture has been ordered, and what are you seeing here? Xanthomas are what you are seeing, and what is the finding that you expect in this individual when you send his lipid profile? Once more, what is the rule when you are preparing for DNB, AIMS, PGI, JIPMER, ABPG or any PG medical? Hyperlipidemias and hypolipidemic drugs. Favorite topic of examiner. If you did this question wrong, straight after going home, post dinner, एक मसाला चाय पी के बैठ के 12 घंटे 12 बजे के पहले खत्म करो. What? Hyperlipidemia, hypolipidemic drugs. Definitely one question will come. So doctor, it's a case of familial hypercholesterolemia caused by the LDL receptor gene deficiency, which lead to xanthomas on the tendinous insertions, and that typically lead to only cholesterol, not triglyceride. Elevated LDL and cholesterol is what need to be remembered. What is the typical pattern of lipid profile in a diabetic individual? Favorite question of examiner. Cholesterol will be normal, but triglyceride will be high. So that is very special feature in case of diabetic lipid profile. 55-year-old with chronic ischemic heart disease has difficulty in breathing, and there is a distension of the veins of the neck, and there is a tender hepatomegaly. What is the mechanism of his edema? So fundamentally, there is an increased capillary hydrostatic pressure because of the right heart failure, which is leading to development of the Starling's forces imbalance, leading to edema in case of CHF is what you need to basically understand. 57-year-old is receiving hydrochlorothiazide for the management of hypertension along with the Caesapride, and he took an antimicrobial drug. And what has happened? There is what is the heart rate here? Between one QRS and other QRS, you look how many large boxes are there, doctor. 300 divided by the number of large boxes between two QRS complexes is the heart rate. So how many large boxes are there between one QRS other QRS? 1. So 300 by 1 is almost 300 is the heart rate. If you look at the QRS morphology, it is not uniformly maintained same way. Hence what is this called as polymorphic ventricular tachycardia, which is also called torsidis depointis, which occur because of the prolongation of the QT interval. What is the normal QT interval? 420 milliseconds is normal QT interval, and any QT interval which is more than 600 milliseconds, corrected QT interval, is called prolonged QT. Prolonged QT is a risk factor for development of the polymorphic VT is what you have to remember, and it is the erythromycin which basically, if you give along with a macrolide drug like erythromycin, along with the Caesapride like a prokinetic drug if you happen to give, then that combination lead to development of polymorphic VT is what you have to basically remember. Now the complete blood picture is showing neutrophilic leukocytosis more than 10% of band. His body temperature is 102 degrees in a 42-year-old. What do you find on his big toe? Inflamed first toe metatarsophalangeal joint, pathognomonic of gout, right? And what is the treatment? At least one case if you see, you will never forget in life. You give indomethacin to him, 10 minutes pain will be out. Oh, patient will consider you as Shankar Baba MBBS. Huh? So suddenly from Shankar Dada MBBS you will become Baba MBBS, and that healing power, ultimately it is the relief of pain that makes you a great doctor, right doctor? So it is the urate crystals is what you will find in this case of gout is what need to be remembered. 34-year-old sweet looking nurse from Bihar working in a tribal PHC has got a very high temperature, and all her clinical findings have been given, and a thin smear has been taken. What do you find in this? Band forms, trophozoites of Plasmodium falciparum. So that is the reason it is a case of cerebral malaria, where the ring forms of propocytes of a gene sustained RBC is what need to be remembered. One more thing, doctor, if a slide is shown, malaria is in the options, what examiner want? Malaria. Clear? If the options is having apoptosis, what is the answer? Apoptosis is the answer. If lithium is in options, fluoxetine is in options, digoxin is in options, what is the answer? They are the answer. That's the reason knowing high yield topics only is half the success. So even APPG analysis also we will be keeping the high yield topics and all questions classified format, everything made available in newsformedico.com. We will give a free blog. Anybody can access freely on your mobile phone whenever you want. But first know what are the top 30-40 areas examiner is interested in medicine. Right? Those 30-40 without missing, review and go to exam hall. Epilepsy, right? Hypertension, congestive heart failure, diabetes mellitus, multiple sclerosis, like that, another 30-40. So we will give that list. Don't read full list also. If you read full list also, my purpose is gone, lost. Right? Just read 30-40. Similarly, dermatology, 5 questions will come in dermatology in state entrance. Generally, they come from 12 topics. 12 topics, only 12 topics. 12 topics ke liye how much time you require? 6 hours. Seriously, breakfast to lunch, khatam. Not 1 day, 2 day, 3 day, 4 day in your schedule. Right? And on each topic you must know 10 points. Tested. Okay? So that should be the smart way of a quick preparation. Otherwise, this is a endless debt. And if you are not strategic, if you don't have the end point of what I am going to, how I am going to finish a subject, if that end point is not defined while starting to read the subject, lot of students, that is the only problem they face. Everybody want to become MD. Everybody really does hard work, honestly. Everybody say goodbye, make sacrifices, go to reading room, sit. But after sitting, what they are doing is important. What they are reading is important. How focused they are preparing is important. That is, we need to be like investors in a stock market while investing our time in preparation, doctor. So now you have done the pulmonary function test and below normal FEV1 by FVC ratio is there. Once more, a very standard topic. Restrictive versus obstructive lung disease, you must know the differences. So it is a typical pattern of obstructive lung disease. That's the reason there is an increased airway resistance on expiration. FEV1 by FVC ratio is typically diminished, is what you need to basically remember. A man was severely hypertensive and today this 43-year-old is referred to surgeon because he had multiple infections of the left foot and vibration proprioception are normal. And what type of spinal cord lesion possibly can lead to it? Vibration position is carried by dorsal column, right? Then decreased pain and temperature is there. So that is the reason it is the right anterolateral spinothalamic tract which carries pain and temperature is the one which is affected in the hemisection of the cord, is what need to be remembered. So once more, doctor, brainstem syndromes, North-Nagel, Weber, Claude, Parinod, Benedict, all these syndromes, if you have not read Millard-Gubler, all these syndromes, if you have not read, please go through the anatomy2medicine.com has a video, please review. My job is every week to cry like this, to keep on telling you, read this, read that, read, definitely read it. Yeah, that is the job of me. Reading is your job and reminding is my job. And already you have all the videos available in our video library. If you are a good reader, don't listen. If you are a good listener, don't read. Simple rule. So you have got a plenty of stuff available for you to on mobile phone also to revise the video. 42-year-old with nasal polyps with asthma, increased risk is there for what? Typically hypersensitivity to aspirin is what you have to basically remember. Then during a neurological examination, the patient, physician shows a patient a key and asks the patient to name the object. He has an inability to name that object, that's called anomia. Anomia occur in which lobar dysfunction is a very important question. Temporal lobe dysfunction. Each of the lobes, what do? Our personality, inhibition, social inhibition are all due to the frontal lobe. Like that every lobe has got 5-6 functions. Our right left orientation while driving the car, everything. So each lobe, what is their function? Parietal lobe basically helps us to identify the spatial configuration while we are moving in the traffic, in the car, is what need to be remembered. Then doctor, a 8-year-old has Pelor's splenomegaly, required exchange transfusion, blood film was being taken. What is it showing? Spherocytes, hereditary spherocytes. And what is it? Because of a defect in ankyrin is the underlying problem, is what need to be remembered. Sometimes examiner will give one of the options as spectrin. So you need to be careful among the various structural proteins of RBC membrane. Most common protein involved is ankyrin in the hereditary spherocytosis. 9-year-old who has got Duchenne's muscular dystrophy, it is being found some of his relatives are carrying a mutation in the intron. Intron is something that is a useless part of the genome. Exon is the one which is ultimately replicated. So any intronic mutation does not alter the gene function. That is what you need to appreciate. 6-year-old boy is shown in figure. What is he having? Nephrotic syndrome. Whenever nephrotic syndrome is there, what does he have? Hypoalbuminemia. If the albumin is deficient, whose transport get affected? Bilirubin's transport typically get affected whenever you have hypoalbuminemia. A 16-year-old with hypogonadotropic hypogonadism, and his photomicrograph is being shown to you. He is very pleasantly looking at you, but he is enormously obese, and when he has grown up into a bigger boy at 14 years, he is found to have hypogonadism. So obesity with hypogonadism classically makes you to remember which syndrome? Prader-Willi is what need to be remembered. So upslanting almond shaped eyes, upslanting almond shaped eyes are the classical thing. Yeah, of course lot of our MBBS classmates, some of them may have this appearance, don't suspect them. So yeah. Now doctor, 57-year-old benign prostatic hyperplasia, you have used finasteride. So finasteride is an alpha, pi alpha reductase inhibitor. So where else had it been indicated? One more FDA approved indication is male pattern baldness. Treat karne ke liye you can use the finasteride. Whereas advanced prostate cancer, there is no role for the finasteride. Even the other things also, it has no role. Approval is not there. An anesthetized patient undergoes plastic surgery and ventilated with 30% oxygen, 70% nitrogen, and when ventilation is stopped, the patient could not breathe for 2 minutes. What is the cause? Because in his body the PaCO2 was very low. It is the PaCO2 which will be inspiring our brain to respire, right? So to prepare also we require a good critic who asks us few questions and say, don't you know even this also. Such friends also we require. PaCO2 plays that inspiring role by stimulating the brain. So that is very, very important. A 29-year-old woman who is on diazepam to control anxiety, she is also taking an antidepressant, and which antidepressant enhance the action of the diazepam by inhibiting its metabolism. If fluvoxetine is in the options, SSRI is the king among chemicals to treat depression. That is the answer is what you need to remember. 32-year-old assistant professor of medicine in government medical college has repeated episodes of chest tightness, lightheadedness, etc. because he has to go, he is worried about his transfer. Big clinicians also will ultimately go and stand before a IAS officer to get their postings, unfortunately, right? So, if you take a MBBS doctor, a passed out MBBS doctor, you joined as a civil assistant surgeon doctor, you are on par with whom in police department, do you know? You are on par with a deputy superintendent of police, DSP, right? And if you are a civil surgeon, you are on par with commissioner of police. So you are a powerful position in health sector, doctor, be very sure, right? But the only thing is we need to exercise that power and authority, both by virtue of our knowledge and service. So panic disorder is what he is actually suffering from. Then doctor, while skating in Shimla during honeymoon, a young doctress like lioness, doctress, etc. So has fell down and had a hyperextended knees. So what is the problem? It is the anterior cruciate ligament which keeps our knee from going into a hyperextension. So that is the reason it is an example of a anterior cruciate ligamental injury is what you need to basically remember. Then a 54-year-old had a fracture involving what? Surgical neck of humerus. So whenever it is involved, then what is the nerve which is injured? Axillary nerve is the one which is injured when surgical neck get affected. Now the lesion is showing a flaccid tongue, half of the tongue which is being pushed. So what is this lesion? Fundamentally flaccidity is a sign of LMN or UMN? LMN. Okay. Then what are the two nerves whose paralysis will lead to flaccid tongue? Either lingual nerve or hypoglossal nerve. So that is the reason it is a case of left lingual nerve which got injured, leading to the typical appearance is what need to be remembered. So what is the purpose of the muscle supplied by the hypoglossal or lingual nerve? It is to push the tongue to opposite side. Got it? Suppose if that got paralyzed, then the other side of the tongue which is normal will be unopposed. So the side where paralysis is there, that side tongue will twist. Normally it will push it opposite. If it is weak, then what will happen? The other person will come and fall on it. So that is the reason the tongue is turned towards the side where there is a flaccid paralysis is what you need to ultimately appreciate. Now doctor, a 28-year-old from Ahmedabad suffers generalized focal epilepsy. It is located in left temporal lobe and the temporal lobectomy was done to manage that medically resistant epileptic seizures. So what is the consequence of temporal lobe removal? It leads to development of superior quadrant anopsia on the right side. That is the consequence of a left temporal lobe lobectomy is what need to be remembered. Once more doctor, visual pathway defects. Hottest topic in PG medical entrance. Without that there is no paper. Which is congruous hemianopsia, which is a macula sparing type of a hemianopia, right? And which is superior quadrant anopia, inferior quadrant anopia. Entire visual path defects may one of the defect is definitely going to be there in PG entrance, any entrance you go. 92-year-old has a hearing loss. So whenever there is a presbyacusis, what is the pathology? Typically the hairs on the surface of the inner cells are the ones which are reduced, which is the underlying pathophysiology is what need to be understood. So that is the story of all case based and image based questions.